Welcome to True Health Tuesday. And the truth, which the Ministry of Truth will allow us to say, will set you free. Okay, we're going to go on breathing and lung health. Now, oh my gosh, I forgot those pictures. Okay, now, you might think that putting a mask over a child that has a 99.9997% chance of not having an injury might be cruel and unusual punishment, and you'd probably be right, but this is about breathing and lung health. Now, we are going to have a substantial censorable portion, which won't get by some of the censors. And so this is going to be all on Dr. BVIP. If you're there supporting us, God bless you. Thank you. Okay. Just know that if you're watching that, it's going to go through uninterrupted. And also, eventually, we're going to have it on Extreme Health Academy. We're trying to sync that up with Vimeo so we can get it a live stream in there too. So let's look at how the body works. Last week, we talked about digestion. Well, lungs are hugely important. And in fact, you just see carbon dioxide go out. That's an acid. Now, the way the body works, we have a nervous system that controls it. And the bronchial constriction and dilation has to do with the parasympathetic nervous system. And that's located at the base of the brain and the sacrum area. Now, the base of the brain is the cardiac and respiratory center. So it's huge. And the way I used to teach it is C3, C4, C5 keeps you alive. And that's the phrenic nerve. Now, the diaphragm, when you're looking at this, it's down at the base, okay, of the lungs. And so when you breathe in, it's like drawing in that air, okay? When you blow out, the diaphragm comes up and the air comes out. So now that diaphragm is a muscle. And when we talk about altered nerve supply to the diaphragm, there's a lot of stuff that can happen because you've got the esophagus going through that's connected to the stomach. And if the diaphragm is weak, because let's say there's a problem with the neck, whiplash trauma, lateral deviation, that can compromise the nerve supply to the diaphragm and alter diaphragmatic function. Well, that can actually allow the stomach to pooch up, and then that's a hiatal hernia, and it can cause reflux. There's a lot of problems that can go along with the diaphragm. But we're just going to look how the body works now, okay, not how to solve that issue. Now, when you breathe in, okay, and this is typical Americans, okay, I don't know if Brits do it, but let's test it. Okay, so sit up nice and straight. I'm going to check how you guys breathe. Okay, so now on 3, you're going to take a deep breath in. 1, 2, 3. Okay, good. You're breathing like an American, and that is a Brit. Okay, when you breathe in, okay, and this is how human beings, how Americans breathe. When American breathes, they'll go in, their tummy comes in, and their chest comes up. That means you're using the top third of your lung, which is the least surface area of the lung. When a normal human breathes, and you look at little kids, because they haven't messed up yet, the bottom or the tummy comes out on inhalation. So a normal breath is, okay? So it's like a bellows almost. But if you try this, and it's really tough to teach people how to breathe correctly. So what I'll do is I'll put one hand here, and I'll say, okay, I'm going to punch you in the stomach. And I won't really punch people unless I, having a bad day, and it does make a person feel better. No, I'm kidding. Okay. So what you'll do is if you get punched in the stomach, do you breathe in or do you blow out? You blow out. So you blow out. So push in your tummy on 3. 1, 2, 3. Blow out. Now breathe in and push your tummy out. Blow out and push in. Breathe in and push out. Okay, so now you're breathing diaphragmatically. If you've only had 2 of those breaths and you're not used to breathing that way, you're going to feel a little dizzy. Okay, because now you're finally getting oxygen to the tissue. And this is how human beings breathe. I know. You're thinking, dude, you really got to explain this. Okay, so now you have these alveoli. Okay, they're little like clusters of grape. And these are at the end of the air tubes. And the air tubes, you got the bronchus, and they go in there, and these things go everywhere. Now, these alveoli open and close. And the way they're supposed to do it is they have a clear lubricant inside called surfactant. Now, if you're fully hydrated, you got a good immune system. That surfactant is everywhere, and it allows the oxygen transfer. And this is what breathing actually is, because when you're breathing out not just carbon dioxide, but you're breathing out all the waste products from the blood that have gotten into the lungs. You're breathing out molds, funguses, a bunch of things. That's why, I mean, putting a mask over your face and rebreathing in your own waste products sounds like a really good idea to strengthen the immune system, but physiologically, it doesn't make any sense whatsoever. Now, let's say that you have blood that looks like worms. Okay, that is not healthy blood, but that's what commonly occurs under stress responses. If you have low stomach acid, you're not going to get the amino acids, so the blood cells start to look sticky. And if they start to stack on one another, that means the beautiful red blood cells, which are like two frisbees glued together, so they have a biconcave disc, so they can hold oxygen, carbon dioxide, beautiful design. But if they start to clump together, you're not going to get that healthy oxygen transfer. And what's interesting, I mean, there's a guy's blood before and after doing chelation, detoxing him. But still, think of this. If you have to transfer oxygen and carbon dioxide and your blood is not efficient at doing its job from chronic stress, what do you think has to happen to blood pressure? It has to go up. So this is why, if you do have high blood pressure, it makes a heck of a lot of sense to find out why it's high. Okay, you look at the physical, chemical, emotional stress, because if you have blood like this and you take a drug to lower it, you are not going to get healthier, you're going to get sicker. Now, the bronchus, okay, open and close, they dilate. Now, I'm going to show you how to dilate the blood vessels and the bronchus by using this beautiful thing above your mouth. It's called a nose. I know, it's like no shit. Okay, so if you breathe in through the nose, you're actually creating nitric oxide, which bronchodilates and vasodilates. You're heating it up. It's actually beneficial. And if you breathe out through the mouth, you're getting rid of the air faster. But breathing in and out through the nose is actually the best. So if you're breathing diaphragmatically in, you're going to bronchodilate and vasodilate. Now, when you're looking at asthmatics, that's that picture on the far right. Asthmatics have 10 times the amount of mucus in their lungs than a standard person. And I've removed lungs of a bunch of people when I was teaching human dissection. And there's no difference between an asthmatic lung and a normal human lung. Okay, there is an emphysema. You can actually slice it up and you can see the breakdown of the tissue, but you're not going to see a difference. Now, what's interesting, though, is think of this. The steroids and inhalers that they give, force those bronchus open because an asthmatic, the air is locked in their alveoli. They're like drowning in their own air. This is a panic moment. And that leads to further constriction. So the steroids that they take open up those bronchus, but that steroid is a sympathetic dominant state, sympathetic dominant. So it will activate the sympathetic or the fight or flight nervous system. So, and that's going to put you in a greater state of stress. So, I mean, there's a lot of athletes that say they're asthmatic so they can get that inhaler, so they can get that good rush before an event. Because inhalers are one of the few legal enhancers that you could use. You just have to show that you do have asthma. So when you're looking at an asthmatic, dehydration is one of the causes of that excess mucus. Also, altered nerve supply to it, because what I'll tell people is asthma is not a problem of the lungs. It's a problem of the smooth muscle control of the lungs. And that's governed under parasympathetic nervous system. And so you can correct it. But now let's look at asthma, okay? When you look at the World Health Organization, they say asthma is a disease of the privileged class, okay? And higher income education levels associated with a higher prevalence of asthma. And the Lancet, although asthma is at present a disease of affluent society, westernization and urbanization of the population elsewhere in the world are leading to increases of the prevalence. Really? Really? So why would it be affluence? Okay, when we're talking pressure on the cardiac and respiratory center at the base of the neck or the base of the skull, C3, C4, C5 keeps you alive. That's the nerve to the diaphragm. Why? Well, let's look at this. According to the European Respiratory Journal, Lancet, British Medical Journal, they say that a rural lifestyle, so that means you're living around all these different pathogens. You're living around pollen, you're living around animals, you're living around all these different dust particles in the air, that you have less incidence of asthma. Exposure to farm animals and drinking raw milk, unpasteurized milk, is protective for asthma. Why would that be? Well, because you're actually getting healthy bacteria in your system. And bacteria are a vital part of your immune system, your gut function, and how you adapt. Because your body has to know what to fight and what not to fight. This is why it's called the hygiene hypothesis. The more you destroy bacteria, and you can just look at hospitals, how'd you like to have your house as clean as a hospital? Well, about 128,000 people a year die from hospital-acquired infections. So, that's probably pretty foolish. And you might think, well, in this psychotic era, all the people using Clorox and Purell everywhere, are they really fighting a germ or are they weakening the immune system? Okay, so the presence of pet in the house and large families are protective against asthma. So think of this. Your body gets stronger when you live like you're a human. Wait, your body and immune system get stronger and you have less of a negative environment if you live according to your genetic makeup, where you're in a communal being surrounded by animals and family and plants and everything, not isolation. That strengthens your immune system, and your immune system can recognize what to fight and what not to fight. Does that make sense? The British Medical Journal. These findings suggest that a rich environment, rich in microbial organisms, is beneficial to building infants resistant to asthma. Amazing. Amazing. So we need this bacteria. We need this environmental challenges in order to strengthen our immune system. So this insane fear that we have is actually weaken our immune system. The search for environmental agents that protect against asthma is extremely important and holds the best chance for success of prevention and control of the disease. Now, well, this is at a UCL Public School of Health. So please, Mr. Censor, I didn't really say this. Yell at the UCLA Department of Health. Conclusion: DPT or tetanus vaccine appears to increase the risk of allergies and respiratory related symptoms in children and adolescents. Yeah, well, because it triggers a Th2 or an inflammatory response, as well as does certain things that activate the immune system. And that's, according to the CDC. So let's look at this. How does a normal human being react to inhaled substances? And I'm talking like pollen, a fart, but, okay, no, you crinkle up your nose if you smell that. Okay, but I mean pollen or pathogens like dust. Okay, well, first, when you get exposure to that, your area becomes narrow, okay, because you're going to limit that. Blood is going to rush there because your body wants to wall it off, and mucus production increases. So this is a normal response. This is why if you're exposed to dust or dirt or something that's bad, you're going to cough it up. Okay, and that's how human beings work. But again, in our society today, do not cough in the presence of other people unless you want a clear table where you're sitting. Or if you want to ride up in the elevator alone, you can do it in the elevator. Now, an asthmatic lung is a hypersensitivity reaction. And this is similar to what's going to be happening in our population with antibody-dependent enhancement. But when we primed the immune system to overreact, and I'll see this on a lot of people now, typically the standard person that's going through the standard medical procedure. And I'm talking the average kid 18 who's getting 72 doses of 17 different vaccines. It's an unusual experiment, but you'll see on these kids that when you touch them, their skin turns white. Okay, this is excessive histamine, and you'll see that a lot. Now, the asthmatic response to inhaled substances involves bronchoconstriction, inflammation, and excessive mucus production. So it's the same reaction, but it's more sensitive. Okay, does that make sense? So it's a hypersensitivity reaction. So it's really an immune system. It's not really a lung issue. Now, viruses, according to the British Medical Journal, are beneficial for asthma. Early childhood infections and development of asthma. Repeated viral infections other than the lower respiratory tract early in life may reduce the risk of asthma. So again, your immune system thrives on challenges. Okay, thrives on challenges. And this is the key with thriving on our planet. Of course, antibiotic use in infancy increases risk of developing asthma. And it's interesting, the association between antibiotic use in the first year of life and current symptoms of asthma, conjunctivitis, eczema in kids 6 and 7 years old. So this is just giving them and this is, well, one of the questions we did before we started this, when people asked about when antibiotics are appropriate. Okay, antibiotics are appropriate when you have identified the pathogen, have done a sensitivity test to identify the one drug that's going to fight this pathogen, and it has to be very, very severe, the risk-benefit ratio, because antibiotics increase risk of cancer. They do a lot of negative things. It can destroy your gut flora. There's a lot of things that it does that are dangerous. So understand there's a risk-benefit ratio with everything. And if you're taking an antibiotic for a common cold, that's not smart. See, I didn't say stupid. In asthmatic patients, they have a Th2 response, which is more of an inflammatory response, different than a Th1. And antibodies are produced, the inhaled allergen. Inflammation occurs, airways thicken. In essence, asthma is a result of an immune response in the bronchial airways. That just makes sense. So when you're looking at this breathing, it's not the diaphragm, it's the immune system, and it's the nervous system control, because what controls the bronchial constriction is the parasympathetic nervous system, and that's located in the neck. That's the cardiac and respiratory center. So when you look at the cause of asthma, we're looking at dehydration that increases mucus production and decreases surfactant production. We're looking at compromised nerve supply to the diaphragm or the parasympathetic, which alters that vasoconstriction. So there's a reason for it. It doesn't run in families, but environments do. So if your dad was a hyper clean person that was doing Clorox everywhere and you never got exposure to healthy pathogens, okay, you might be a psychotic person that recommends hand washing and mask wearing and social distancing, like our great god Fauci. Okay, conscious breathing. This is one of the coolest things ever. Okay, when you're breathing, and this is what you can do, it's called diaphragmatic breathing. Okay, but I want you to do this diaphragmatic, but it's a way to expand your lung and to meditate. Okay, it's literally when you breathe in half as long as you breathe out. Okay, so this is when you see an 8 seconds breath in, you're filling up your whole air. Okay, and this is filling up the gut with air. It's actually having the diaphragm come down so the stomach contents move out. Now, when you're diaphragmatically breathing, you're massaging those organs. You're literally moving the lymph flow around. So the diaphragmatic breathing is hugely important. And then you breathe out twice as long as you breathe in. But what you're going to do is hold this. So when you're going to breathe in for a count of 8, ready? You're going to breathe in, ready, go. Now hold it for 10 seconds. Now breathe out. Okay, now you're supposed to leave all that air out for 10 more seconds, okay? Except that's not fun and I can't talk with no air. Okay? But just do this, and if you do this on a regular basis, you can also look at Wim Hof method. That's fantastic for oxygenating the brain. But if you're having trouble remembering something, let's say you're doing a test, or let's say you have a little bit of dizziness, it's typically lack of oxygen to the brain. So do about 10 diaphragmatic breaths. Okay, that's going to oxygenate the system and get the brain to function correctly. Because remember, that 3-pound brain burns 90% of the body's oxygen and 30% of the body's calories. So it's really, really important. Now, it's interesting because when we look at glyphosates, and this is one of the most powerful antibiotics out there, it's also a mineral chelator, and it's designed to sell herbicides. I mean, well, it is an herbicide. It's designed to sell genetically modified plants that can withstand this poison. However, this is now a cancer-causing agent. It's in our water, it's in our air. So this is not a real good product. But when we look at it, glyphosate is probably the most important factor in the development of multiple chronic diseases. and conditions that have become prevalent in Western societies. Dr. Stephanie Seneff. And the reason is, remember, we have a relationship, okay, with bacteria. We need it. And in fact, 80% of your immune system is in your gut. And you have more bacteria, 10 times the amount of bacteria in your body than you do your own cells. Now, 2 to 3 pounds of bacteria in your gut. And this is what breaks down some of the nutrients, protects you. It's hugely important. This is why the big rush on fermented foods and bacteria. Now, viruses, you have even more than that. You have 10 times the amount of bacteria. So you have quadrillions of viruses. So this is actually part of your makeup. And in fact, Dr. Philip Sharp, Nobel Prize winner, humans are well over 50% viral. That means that little strand of DNA, viral particles transfer information. And that's, I was having a discussion with a young guy earlier about how viruses transfer information, and viruses actually have to utilize host RNA or DNA to replicate. And this is why when you see the RO factor or reproduction rate or infectivity rate of a virus, that it has to go from one person to another. It has to utilize their RNA or DNA to transfer information and to replicate. Then it's got to go over to another person that's susceptible, and that replicates. So it's literally, that's how we're designed to live. We're designed to live in a sea of bacteria, viruses, funguses, and pathogens. And this is how our system is designed. It's foolishness to be afraid of our own world. Now, children who drank raw milk had a 41% chance, reduced chance of developing asthma, 50% reduction in hay fever. Why? Well, you got the colostrum in the raw milk. The fats aren't damaged from the homogenization process. It has good nutrients in there. I mean, it's amazing. Journal of Allergy and Clinical Immunology. The findings suggest that protective effect of raw milk consumption on asthma might be associated with a whey protein fraction of milk. It could. Now, Tylenol, it actually damages the body. It depletes the body of glutathione. Now, if you do have Tylenol, it's funny, I was having a discussion with one of the docs in Mexico, and we were looking at these symbiotes on a dark field microscopy. And he says, those aren't really well studied. And I said, yeah, we're still learning how the world works. And if you think the science is settled on anything, that's a fool's approach to life. Okay, you got to always be open to learn. And so when we talked about these symbiotes, and I gave him some studies from some people that have worked in the field for 40, 50 years, and their theories on it. And that's the dynamic, fun stuff. But since he was really clinging on to the old, we need data, I said, okay, show me how Tylenol works. Anybody know how Tylenol works? No, neither do they. It says mechanism of action is unknown. We know it's the leading cause of liver damage. We know it's one of the deadliest drugs in America. And we know it's like a snake oil salesman. It's good for headaches. It's good for joint pain. It's good for this. It's good for that. How does it work? We don't know, but it's good for you. It's foolishness. European Journal of Public Health, 20,000 children, the children in the younger age group who receive the medicine once per year, that means one time, not multiple courses over a week, once, had 70% greater risk of asthma, while those that receiving Tylenol once a month or more were 540% increase of asthma. Isn't that interesting? Tylenol. Now, when you're going to give this to kids is to reduce a fever, right? Okay, or a headache. Now, I was always taught that symptoms are there for a reason. Okay, and if you respect the human body and the child, there's probably a reason for the symptom. Does that make sense? So, and if you know that a fever, for every 1 degree increase in temperature, the speed of the immune system doubles. And if you know that viruses, funguses, bacteria die at a higher temperature, so this is an immune system response to pathogens, you don't want to destroy it with a chemical that you don't know how it actually works. Does that make sense? It should. Now, Tylenol depletes glutathione. Now, this is huge because glutathione protects your brain. It protects your liver. It's hugely important. It's an antioxidant. Antioxidants actually clean up or help the inflammatory process rebuild healthy tissue. So what kind of things, if you are going to, or if you've been exposed to Tylenol, increase in glutathione. Now, this is going to be sulfur-rich, the cruciferous family, cauliflower, broccoli, whey protein. Glutathione is vital intracellular and extracellular protective pulmonary antioxidant. Plays key roles in regulating oxidant-induced lung epithelial function, also in the control of pro-inflammatory processes. I mean, brilliant. Smoking and vitamin C. If you are a smoker, switch to organic tobacco. It has less pesticides. It's not particularly better for you, but when you know that smoking generates dopamine, so if you're in a stressed state, and I just had a patient today that her husband said, "You're not going to tell her to stop smoking?" No, every doctor on the planet's told her. Okay, what I'm going to tell her is increase your vitamin C, because when you looked at this gal's x-rays, she had laterally deviated, forward head carriage, and there's a lot of physical stress. When we did the other studies, we found chemical and emotional stressors. So to tell somebody that's got massive physical, chemical, and emotional stress to stop the one activity that makes them feel good, is that cruel or cruel? Okay, it's like putting a mask over a child. Wait, no, that's stupid and cruel. Okay, so this one, supplement with vitamin C. It's like we had a patient who painted cars for a living. He was doing 3 packs of cigarettes a day. That's a lot. I don't know how many is in a pack, 20 or 25, something like that. How many? 20, so that's 60 cigarettes a day. So I told him to go over to the smoke shop that's in our shopping center and get the hand roller, get the organic tobacco. He went from 60 cigarettes a day to about 10. Because while he was rolling them, he was doing that nice thing for himself. Okay, so, just know. Now, 15 milligrams of vitamin C per day prevented all of the damaging effects. Now, vitamin C, citrus-rich fruits, okay, but strawberries, tomatoes, broccoli, kiwi fruit, amazing. This is something that you should be having every day. And in fact, in my water, I've got Vitality C with ribose. It's 10,000 milligrams every day. Hugely important, hugely important. Vitamin A, this helps the lung function when you're looking. And it works synergistically with minerals and vitamins. So if you're vitamin deficient, if you're mineral deficient, you can't utilize vitamins. If you're in a chronic stress state, you can't absorb the minerals. So there's a lot of things that it's vital, not just with vitamin A. Where do you get vitamin A? Raw butter, whole milk, okay, fatty foods. You can get the veggies, carrots, sweet potato, kales. I mean, it just makes sense. When they say food be your medicine and medicine be your food, we are designed to live here. There's no reason that we need to have a lot of these inflammatory diseases if we live according to our design. Here's a guy. Do you see any structural problems on him? Yeah. So in this world, the doctor is smarter than your own physiology. Now, if you are built like this, okay, from some past trauma, do you think you're in a stress state? Yes or yes? Of course. Now, 5 medications, 2 high blood pressure drugs. Now, what's a normal human blood pressure? It really is the body is going to adapt. And, it's like I'll say this to a lot of people. Do you have a dog? And, yeah, I have a dog. Did you check their blood pressure this morning? And they'll look at me like, huh? Why? Well, a dog's going to regulate themselves. Okay, well, humans are the same way. Think of how crazy this is. I mean, 100 years from now, people will be looking at this and going, no way. Okay, the doctor is smarter than your own physiology. He's not going to look at why you're adapting to the chronic physical, chemical, or emotional stress. They're not going to address any of those. They're going to leave you in that stress state, but give you a chemical that forces your blood pressure down lower. Now, your blood pressure is going to be here. If you take a chemical to lower it, like an ACE inhibitor, beta blocker, diuretic, your arteries are going to constrict, because like putting your thumb over a hose to get it back up there. This is why each time you take a blood pressure drug, your risk of stroke actually increases. Okay, now he's taking a thyroid drug. Did he have his thyroid operated on? No. But when you're in a stress state, your adrenals are going to be firing and the thyroid's going to be low. So it's going to appear low. And most doctors don't do a really thorough exam to find out if there's high cortisol, if the cortisol could be negatively affecting the thyroid. An antacid when you're in a stress state. Do you have healthy blood supply to the gut? No. The rest, digest, and repair is shut down and the fight or flight is active. So if you're taking an antacid, that means that you have low stomach acid, okay? That's weakening the lower esophageal sphincter, so acid is slashing up. So reflux or indigestion is from low acid. Now they're giving an antacid to decrease it even further, which causes low mineral absorption. And then it's also with low minerals, you're going to have cardiac arrhythmias. That's why most of the antacids actually cause cardiac arrhythmias and bad problems. Now, pain, what does pain do? Pain elevates that sympathetic and shuts it down. I mean, it's crazy that none of these are diseases. They're all adapting to stress. And the doctor, in their arrogance and ignorance, is going to give you a toxic chemical to alter your physiology without addressing the underlying factors. Here's the same guy. Okay, before, after. Sorry, I just went back and forth. Okay, so you can see there's a little bit less physical stress. And then we showed him how to check his blood pressure, showed him how a healthy diet would work, got him on juicing and blending, cleaned up his blood a little bit, and no medications. Okay, does that make sense? I mean, look at the body has intelligent, look at the body has designed to live here. I mean, it just makes damn good sense. So in this psychotic environment, okay, where people are putting Purell on every hand, they're making you do things that are against how you're designed to live here. There's an innate, inborn intelligence in the body. Does that make sense? The health is the natural state. Now, if you drop a brick on your foot, will it hurt? Yeah, unless you got, some type of diabetes or peripheral neuropathy. Yeah. So pain and symptoms are normal in the human condition. Okay, so you're not going to be just isolated from everything. I had a patient, this is 20 years ago, a 16-year-old kid that lost both of her parents. She was living with her aunt, and she was taking antidepressants. Think of that. What does antidepressants do in a 16-year-old? This is a tragedy. It's a loss. Okay, I mean, my dad died when I was 14. Okay, so does anybody have a loss similar to that? Is that medication deficiency, or is it some challenge that you go through to get more independent? It's part of life's challenges. Okay, it's not drug deficiency. Now, the vaccinations, that would be cool to study. Medical schools shouldn't get funding from the pharmaceutical industry. They should be independent. Healthcare research should be independent. Wow, that makes sense, doesn't it? Pharmaceutical industry will be financially and morally responsible for their product. Yeah, I mean, like the current craze going around, okay, there's no liability on the gene-altering medical procedure that had no long-term safety studies that's being required by some companies. It's mind-blowing. And all humans will be able to choose any healthcare procedures. None will be forced on them. Do you want independence, or do you think that you're not smart enough to decide for yourself? How would you like to have the government decide for your kids on what medical procedures they're going to have done? Oh, I'm sorry. That's already being done. Okay. Yeah. No, let's take it back, because this is just common sense. You are human beings. You have the reasoning ability to look at the data and to decide for yourself. We're going to be leaving this part about lung health. Okay, look at how your body works. It gives symptoms for a reason. Okay, take care of your body, get your nervous system checked, look at the physical, chemical, and emotional stressors, and your body will recover. We got a 100% success rate fixing asthma, because we're not looking at asthma, we're looking at the underlying stressors, because asthma is the end result of a toxic and deficient system. We're set? Okay, now I'm going to say bye to YouTube and Facebook, and if you're on Dr. BVIP, you will keep going on, and we're going to go over to some really, really cool stuff. Next week, we're going to go over some more anatomy and physiology so that you confidently approach the world like a human.